A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional.
Welcome back to the PEMF podcast. Today we're going to be talking about children using PEMF, as this is warned against in many product manuals, but is it actually bad? And should you not use PEMF on your kids? And if you are going to, what are the benefits and how should you actually do it? This is all what we're going to cover in this episode. We're also going to throw in some studies and that too. But we'll kind of start on, why do the product manuals actually say that you shouldn't use PEMF on your children? Is it actually dangerous?
Yes, it's a great question because it's one that we get really frequently. And actually, some people are actively looking to treat their children with PEMF therapy. And they come to this barrier of looking into the manuals, and the manuals are stating it's a contraindication. So it's a question we get asked quite often. And the simple answer to this question is no, it's not dangerous, but there's a lack of research. And that's one of the reasons why the manufacturers would prefer to put it at like children as a contraindicator.
One of the biggest concerns that parents wanting to use PEMF on their children kind of face is it going to affect their growth? That's kind of probably the most common question we get asked. Is it going to affect their growth, and is it kind of dangerous for that?
Yeah, so another great question, because actually when we're talking about growth, especially when we talk about like smoking and that sort of thing, we're actually thinking about stunting growth, whereas this is the opposite with PEMF therapy. The worry is that you would accelerate growth. So you'd end up with these super huge humans treating with PEMF. And that is the, just as it accelerates healing, can it accelerate their growth during their growth phases? We'll take a deeper dive into this and why it shouldn't really be too much of a concern. But the reason this concern is out there is a number of studies out there. And there's one in particular that treated fish. And what they were doing during this study is they wanted to see if they treated one tank of fish with PEMF therapy, whether they would be healthier, whether they would live longer, and whether, the fish would just generally have a better life. And they did prove that. What they did was they put two fish tanks, one was treated with PEMF and one wasn't. Because it was quite an easy way to treat the fish, because effectively what they were doing was they were putting a PEMF device under the tank. They were applying the PEMF therapy 24 hours a day. So they were treating these fish in the control group with 24-hour PEMF therapy. And they found that they had all these benefits in terms of lived longer, they were healthier. But one thing they weren't expecting was by the time these fish had gone throughout their growth stage, they were twice the size of the fish that weren't treated with PEMF therapy. So what that showed is that PEMF therapy actually influenced their growth stage too. So we know that PEMF therapy works at a cellular level, it works on bones, it works on healing. And actually it showed to grow these fish twice as big. So some people are worried about using PEMF therapy on their children because they think that they're going to influence their growth. Worst case scenario is you could probably do that if you were treating or using PEMF therapy on your children 24 hours a day. So when we're thinking about, keeping a kid still for 10 minutes is hard enough. So, if you put them on a PEMF device and you treat them for 10 minutes or 20 minutes, you're going to help with loads of different things. Mood regulation, which we've mentioned in a number of different podcast episodes. You can help with treating their body if they've broken a bone and that sort of thing. Those effects usually happen within the 10 minutes, and then those cells will stay like that for up to 8 hours. So that's all you need to do. You don't need to treat them for 24 hours a day. So essentially, as long as you're using a PEMF device correctly, then there's going to be no risk of overgrowing your children.
Okay then, so talking about applying PEMF to children, how should you do it? Should you use like a super high intensity device? Should you use a low one? What kind of would you say?
Just for general good practice, really. Super high intensity devices, there's no need to use such high intensities, especially on children. So if they're going to use a high intensity device, or they're going to go to a clinic to use a high intensity device, you can just use it on a much lower setting. But typically, full body systems, lower intensity devices tend to be a lot more calming and chilled for children. And also, again, good practice, probably avoid the head in most scenarios with children.
Okay, great. And how are the benefits for children? Are they exactly the same as adults, or do they differ? How does that kind of work?
Yeah, so really there's no difference in terms of treating adults and children. You're still going to get the same benefits. You're still going to get the same relaxing effects with PEMF therapy. You're going to get reduced inflammation, reduction of pain, increased circulation. So, in terms, you're still going to get the same benefits. Probably the best way to answer this question is to talk about my own experience with my own children. Being a father, I've got two little girls. Right now, one of them is 5 years old and one of them is 3 years old. Completely different, chalk and cheese. They've grown up and we've used PEMF therapy for them for different reasons. To start with, my 5-year-old, Rosabella, when she was born, a few weeks after we found out that she had hip dysplasia. And for anybody who doesn't know, hip dysplasia is when the ball and socket joint in the hip just hasn't formed correctly when, following their birth. And they just need a little bit of assistance. And the normal medical practice is what they do is they put them in a brace. We was pretty devastated at the time. We're like, oh no, perfect child, suddenly put into this brace. And they put them in a brace and we was told that she would be in the brace for a minimum of 16 weeks. And once they've used it for 16 weeks, they'll take another scan, they'll have a look, they'll have a feel. And I think they actually listen for like clicking in the hips. And then they'll decide whether they can take the brace off. So she fitted a brace, and what we did was we applied a localized device because she was pretty small at the time. She was only a couple of weeks old anyway. We applied a really localized device to the area of the hip. And with them devices anyway, you get quite a big treatment area, usually 1 meter or 2 from the device. So, for someone like her, it's quite a systemic effect anyway. And we applied that to her twice a day. So usually when she had a nap, or when she went down in the evening, we would apply a little localized device to the hip area. And we were doing that. It was a low intensity device. And, if anything, it was helping her to sleep as well. And we got to our 8-week checkup. And what they normally do is they make sure the harness is fitting correctly. They need to adjust it, whether they change it over and all that sort of thing. And they did all their usual checks. And they were like, it can come off now. Which is way before they thought it was going to come off. And it was funny, actually, they asked us at the time, have you been doing anything, have you been doing physical therapy, or have you been doing anything differently to speed up this healing? And I told them about PEMF. Again, they kind of just dismissed it and went from there. But, we knew what we'd done. We applied it twice a day and we got really good results with it. For our youngest, Rocky Marie, she is a little bit of a feisty one. She's always had problems sleeping, especially in the first 6 months of her life. She made our lives quite challenging when it came to sleep. We used the device on a really low frequency, so on a delta frequency, and we actually put it under her cot. For the first 2-3 months, we didn't use any PEMF therapy. And then I started introducing it. And what we would do is we would put a device under her cot, put it on the delta frequencies, and then we'd start her bedroom routine. So we'd start talking to her about, we'd start reading her books and all that sort of thing. And we would just find that it would really start to chill her out. And within about 10-15 minutes, her eyes would start to go and she'd start sleeping. And she started to sleep in a much better routine then. So we were using the PEMF therapy, in a way to induce sleep with her and to get her into a normal circadian rhythm. And we found that it really, really helped in that.
Okay, great. So they're obviously more kind of anecdotal results kind of from your own experience. Is there any actual kind of more clinical studies that have been done that have kind of proved PEMF to be beneficial for children?
Yeah, there's quite a large handful of studies actually. There was one major study that investigated the therapeutic effects of PEMF therapy in children and asthma. There was a total of 42 children that were enrolled and divided equally into 2 groups. The first group received both PEMF treatment and standard pharmacological therapy, as in, the standard medical practices, while the other group were treated with only medications. So one was complementary PEMF and one was only normal medications. The PEMF treatment was administered using a 4 hertz frequency, so that's quite low in the delta frequency, and it was a magnetic field strength of 30 Gauss. The treatments were provided twice daily for 30 minutes over a period of 5 days. And the study found that PEMF therapy improved lung function in children with asthma when used alongside the normal medication. The children that received the PEMF therapy showed better lung capacity, increased ability to exhale air forcefully, and overall improved airflow compared to those who only took the medication. And on average, they could inhale and exhale more air with much more significant gains in key respiratory parameters. And additionally, their overall well-being and mood improved, which was something they didn't expect, when looking at the asthma. And in contrast, the control group, which received only the medication, showed a lot less noticeable improvements.
No, great. And that study will actually be available on our Instagram. I'll link it down below if you want to go check it out. And once again, there is loads and loads of studies over there. Loads more information about PEMF. Definitely worth a follow if you want to see some more studies or just kind of some more general information. But obviously, that's quite a different study. You don't really see many studies on PEMF and asthma. I personally haven't seen one. Is there any kind of other studies around PEMF in children? I know we said there's a large handful. Is there any other kind of notable ones?
Yeah, sure. Another one worth mentioning was there was a study that was done that looked at the potential benefits of PEMF therapy and children with cerebral palsy. That condition, just for anyone that doesn't know, is it's characterized by impaired posture, motor control, and balance. Previous research had already highlighted PEMF advantages in musculoskeletal and neurological conditions, which was what prompted this randomized pilot study to assess its feasibility and effectively in CP patients. So for this one, 12 children with spastic cerebral palsy, participated, and they were divided into 2 treatment groups. One was receiving PEMF therapy, and the control group went under like a sham treatment. So, they pretended almost to apply the PEMFs, so that there was no way of telling between the two. The PEMF protocol involved a sine single form with frequencies of 20 to 200 hertz and an amplitude of 1.5 Gauss. So the strength that was used in this was quite a low intensity device. And that was applied 3 times per week for 4 weeks. The session duration started at 8 minutes and progressively increased. So the longer the study went on, the session times were getting longer and longer. The researchers measured dynamic postural balance using a force platform before and after the intervention. This study and most other studies, obviously with it, found no side effects from PEMF therapy, which is something else that's really important to note. It always seems to be a complementary therapy, and there seems to be no side effects. The treatment group showed a significant improvement in fine balance coordination. However, other balance measures did not show statistically significant differences. So this one was a bit more inconclusive, but it did show a really good, significant improvement in the balance and coordination in these patients.
Yeah, no, definitely. That's definitely a common theme that I also see when I go through all of the kind of PEMF studies, that there is no kind of side effects in any of them, really, to be honest. But say there's any parents kind of listening to this now and they are looking to maybe get a device for their kid. What would you say the first kind of steps are or things they need to do to kind of start looking?
Yeah, so again, quite an open-ended question because it kind of depends what you're trying to achieve, but same as you would be for an adult. And actually, we said this on the podcast before, but PEMF therapy devices tend to be like a family system. So not necessarily just for the child, but look for something that fits the whole family. You don't have to necessarily buy a device, especially if you're looking to use it on a child. You may want to just dip your toe in the water and find a local clinic. So that's another option. So, just Google PEMF therapy in my area and see if somebody offers it in the area. You can go and talk to them, use it for a few sessions before you decide whether you want to actually buy a device to take home. But like I say, kind of always go down this same route, is look for a full body system. Home users tends to go for the lower intensity devices, anything from 1 Gauss up to 100 Gauss. But, my preference is always to look for something that offers over about 20 to 30 Gauss intensity. You kind of know you're going to get a bigger magnetic field, something that's going to penetrate completely through the body and get a good, session within the time frame. As I say, there's no, even with children, a lot of people like to throw money at, at their kids and find alternative therapies that will help them. You don't necessarily have to go down the most expensive route because with PEMF therapy tends to be the more expensive devices, tend to be the higher intensity devices, which you would find in more of a professional setting. So look for something within 30 to 100 Gauss, full body, something that's easy to use, something that you feel like your child will apply and use on a more frequent basis. If you're like me and you want to hide it under their cot or something, then something small, and again, it gives you that ability to use it in different frequencies. So you can help with sleep, you can help with their mood regulation, and depending on what you're trying to achieve. Like with my daughter, with the hip dysplasia, we're trying to accelerate the healing. So we found a device that was easy to apply while she was sleeping. So yeah, it's kind of whatever is suited best to your family. But as I say, at NewMed, if you're confused or you need help, we do have consultations. You can just send us an email. You can tell us what you're trying to achieve, what you're trying to get from a PEMF system, and we can try and point you in the right direction.
Yeah, I'll link that underneath this episode, as well as the website. If you want to go on there, you'll be able to find the contact us page on there. And while you're down there, make sure to subscribe, like. If you're on audio platforms, leave us a 5-star review. It just helps us make bigger and better episodes and get bigger and better guests on.
Yes, if you have any other questions relating children, PEMFs, just leave them below this episode and either myself or Josh will get back to you. And thanks for listening to another episode of the PEMF podcast.